So, Assalamu alaikum wa rahmatullahi wa barakatuh. Hello, everyone. It's always a pleasure to present. Here we go again after lunch. Not the best time, but I hope you'll stay awake with me throughout the lecture. So, this is one of my most loved topics, treatment pigmentation, especially after acne. So just a disclosure that this lecture is sponsored by Userain, but all the scientific data. We'll talk only science here, which represents my view. I do not necessarily represent them. So we will talk a little bit about the physiological aspect, about acne, psychological aspect, sorry, and then a little bit about pathophysiology. Then we'll talk about the treatment options and the guidelines, and then we will end the lectures by talking about what's new in treatment. So let's have an overview. We know that acne is very prevalent. So almost 10% of people in the world have had acne. That means 1 in every 10 persons in this room has acne or has had acne in his life. And 50% of these will or have developed pigmentation, which is a high number, 50%. So the thing is with acne, it will go away, right? A couple of months, maybe a year max, it will disappear. But when it's associated with hyperpigmentation, then you have a long-lasting effect. The pigmentation might last very, very, very long. And it actually affects their psychological, very different aspects of the psychological aspects. Like we can see here the difference between the red and the blue graph. We can see that people with acne feel more self-conscious in the presence of others, and they feel also like an outcast. And this is not only because of their pigmentation or how they view their pigmentation, it's also because of how people look at them. This one interesting study that was published in the British Journal of Dermatology actually did something interesting. They asked the question to participants, what comes to your mind when you look at this person? And they had 2 pictures of a male and a female good-looking individuals without acne. And then they digitally altered their image with some acne and some pigmentation. So the first thing that comes to mind to the people that participated in the study, they actually used very positive adjectives, likable, pretty, attractive. But when they looked at the other one, the digitally altered one, with the pigmentation, they used more passive, more negative things. Acne, blemishes, skin problems, okay? But why? Why some of us might get pigmentation while the others don't? We know that actually every type of pigmentation will start with some inflammation. Even if it wasn't inflammatory acne, you will have some micro-inflammation under the skin. And this microinflammation will stimulate some cytokines and some prostaglandin that will stimulate the melanocytes and the melanosomes to be packaged, which will increase the melanogenesis, and with sun exposure, you will have also the post-acne marks. So a lot of treatment out there. Try to focus on different steps in the melanogenesis, going from the tyrosinase to the melanosome transplantation to keratinocytes. But if we want to rank the steps, which one is the most important step in the melanogenesis? I would say actually the tyrosinase enzyme. So a lot of products out there, a lot of actives out there were developed to actually inhibit the tyrosinase. We know there is hydroquinone, kojic acid, vitamin C, and more of these. So when it comes to the treatment options that we can actually divide it to medical and interventional. When it comes to medical, we have the topical agents like hydroquinone and others. And we have also systemic agents like tranexamic acid that showed a good effect in not only melasma patients, but also post-inflammatory hyperpigmentation. We have some chemical peels, PRP that can also affect, although it's a very mild effect on the pigmentation, and finally, some laser and light-based devices. And when it comes to topical treatment, each topical treatment acts on a different step of the pathway of the melanogenesis, like we see here. What about laser? We published this study like 5 years ago about laser treatment of hyperpigmented lesions. But when we talk about specifically the post-inflammatory lesion, although we don't have enough data, we can see that probably Q-switch and PQ laser probably are the most effective ones. Also, their effect is not as good as topical treatments. This is one of the patients with the Q-switch NDAC. We can see some whitening in the right pictures after using the NDAC, and then at the last one on your right, we can see the complete clearing of his pigmentation. Another option is using chemical peels, and this one was treated using phenol peel. And with our skin type, we can also use milder peel like glycolic acid, salicylic acid, and more. But what do we have new now? Maybe this is the latest advance in treating pigmentation, which is Thiamidol. So basically, all the actives that were used to treat Thiamidol were tested not on human tyrosinase. They actually tested it on mushroom tyrosinase. Why? Because it's easily soluble, and it's easy to cleave off and use it in the lab. Human tyrosinase is more difficult to cleave off because it is bound with the transmembrane. So it needs to be cleaved off and then tested. So I would say they were too lazy to test it with human tyrosinase. But lately, actually, after a couple of studies, they managed to test it on human tyrosinase, because we know human tyrosinase is much different than mushroom tyrosinase. And we are actually not mushrooms, so we have to have some tests on human tyrosinase. So Thiamidol was the first active that was tested on human tyrosinase and showed very considerable effect in suppressing the human tyrosinase. And when we see here in this table, we can look at different inhibitors of mushroom tyrosinase, including Thiamidol. If we look at the human counterpart, we will see that some of the actives up there that were thought to inhibit mushroom tyrosinase, they actually don't work in human tyrosinase. They're not effective at all. So using mushroom tyrosinase wasn't the best idea. And when we look at Thiamidol per se, we can see that the effect of mushroom tyrosinase on the inhibition is very strong, and you require a very small amount of human tyrosinase to reach that effect. Let's look at another graph that compared different inhibitors of human tyrosinase, including kojic acid, hydroquinone, and more. We can see that here, the red one is represent Thiamidol. And we can see with the smaller amount, you will reach a higher inhibition of human tyrosinase. And as opposed to hydroquinone, which can actually inhibit human tyrosinase for a longer period, irreversibly, the Thiamidol actually inhibits it reversibly. So it doesn't damage the melanocytes. So you shouldn't get the hypopigmentation that lasts long, like when we use other tyrosinase inhibitor like hydroquinone. And the effect can be actually showed in 2 weeks, but you can reach the maximum effect after 12 weeks of use. We can see the difference here. And even in patients, different patients on skin tone and post-inflammatory hyperpigmentation, you can see the improvement in the pigmentation throughout the weeks. But the first effect can be seen in 2 weeks. This is a study on melasma, and we can see that Thiamidol also works in melasma. I'll give you another study on melasma later on, which is more interesting, but look at this. And it works on all skin tones, and it's very safe to use. You can use it in the morning, you can use it at night, you can use it on all skin tones with less irritation as compared to other actives. That's why a lot of publication, you will find hundreds of publications out there on Thiamidol in very well-known journal, okay? Talking about pigmentation, the effect of tyrosinase, and so on. And this one was published lately in JAD, I think like 4 or 5 years ago. And you can look at the title, Coronation of Thiamidol. It was a systemic review about pigmentation and about the use of Thiamidol in pigmentation. So a lot of key opinion leaders have actually included Thiamidol in their guidelines, and they actually advise the use of Thiamidol in patients with pigmentation. But let's look at this one. This is Very interesting, okay? So this study was done by my friend Thierry Passereau, who has published more than 300 articles about pigmentation and sunscreen and all. So what he did here is very interesting. We know there is we know that we have Klingman formula, okay? The traditional Klingman formula that consists of retinoid, hydroquinone, 5%, and a steroid, right? It's been used as a gold standard to treat melasma and pigmentation. So what he did, he actually removed the hydroquinone and replaced it, the hydroquinone 5%, and he replaced it with amidol 0.2%, and used it on patients with melasma. So how did they fare? We can look at the graph. Actually, the patients we can look at the red one here. I don't know if the pointer, okay, sorry. The pointer is not working. Anyway, we can look at the one here, the red one. This is the Klingman, but the new trio actually acted faster, and they reach improvement up to 70% compared to 38% on the patients who used traditional Klingman formula. Even the quality of life, the melasma quality of life was better in the new trio. We can look at some pictures before and after. The one up there with the new trio, the one down there with the Klingman trio. They both improved, but the difference was significant, with less irritation and more safety, because this one can be used, the thiamidol itself can be used during pregnancy and in the morning. So Eucerin has developed different ingredients, the triple formula, not the triple formula, this one that can reduce the blemishes with a triple effect serum that has anti-marks, the thiamidol, anti-blemishes, and anti-shine. And we can see the difference in the marks throughout the use of this for 3 months. We can see it clinically up to 80% with the visibility of post-acne marks, improvement in blemishes, and decrease also in the Cutibacterium acne with the use of the serum, and also 86% had an immediate anti-shine effect, which is significant, okay? Which resulted, of course, in the improvement of the quality of life. So in conclusion, post-acne hyperpigmentation is a major problem, especially in the skin of color, which can cause significant psychological distress. There are various pathological mechanisms involved, tyrosinase being the main enzyme responsible for melanin synthesis, and we have a very strong inhibitor of tyrosinase in the market. Post-acne pigmentation can be treated with topical agents, energy-based devices, peels that target melanocytes, and thiamidol, again, is a very powerful tyrosinase inhibitor that has shown remarkable efficacy and safety in vitro and in vivo, and it's proven by hundreds of studies compared to other inhibitors. Thank you very much. I hope I finished in time.